Time for the Pat and Aaron Show Injury Report, presented by our good friends at Florida Orthopaedic Institute in partnership with Tampa General Hospital, one of our favorites. Joining us this morning, Dr. Neil Kumar. Good morning, Dr. Kumar. How are you?
I'm doing great. All right, you guys staying dry, I hope.
We are staying dry, thank you, and hopefully everyone else is staying safe out there. We'll continue to give updates throughout the show here, but we need an update on Kalijah Kancey and Vita, both battling injuries for this Buccaneers team, different injuries, of course. When we look at like a Kalijah Kancey who's battling the calf injury, is it best to keep these guys out, considering the Bucs are going to be playing again in a short week against Atlanta on Thursday? What do you think with what you've seen from these guys and their injuries, Doctor?
These calf injuries can linger, and especially a big guy, defensive end, a lot of explosive motion. And it's always hard to tell. These things are just so variable, right? Like anybody who's fancy football guy drafting Christian McCaffrey, you know all about calf and Achilles injuries just lingering. So, and then you got that short week going up against a division rival. I think sometimes you may want to play a little cautious, but you got a big game coming up this week too. So I'm sure the trainers will see how he's responding during the week, and hopefully he looks good. But yeah, they're tricky, especially in these bigger defensive linemen.
And I'm curious whether it be that calf for Kalijah Kancey or the MCL strain that Vita has, those kind of injuries, how much do you have to worry about the short recovery time between Sunday and Thursday, right? As opposed to having a full week between one game and the next. When you're coming off of a soft tissue injury like that, how much more concern should there be about re-injury when you've only got 3 days or 4 days between games?
Oh, absolutely, right? Even for the smallest things. I mean, in every season when you ask the players, when you hear the players talk about that short week, I mean, that's what they all bring up. You know, fortunately, the MCL injuries, sometimes they can brace them up a little bit and try to protect them. You know, obviously, Vita is critical for the defensive line. So sometimes there's little things that you can do to try to get them on the field and ready to go and try to avoid, you know, re-injuring or tweaking the knee again. You know, unlike the calf, sometimes there's not really a whole lot you can do there to try to protect the player while also allowing him to, you know, be at his best.
What about Justin Herbert? He was originally listed as questionable to play Sunday due to an ankle injury, and then he played and appeared to aggravate that ankle in the third quarter against the Steelers. I know the Chargers, especially with a new coach with Harbaugh in town, they want to win some games here early in a tough division. Is he potentially doing more damage to that ankle by continuing to play on it?
Probably not more damage when we think about, you know, causing more tears or injury or, you know, causing an ankle that, you know, sounds like doesn't need any surgery, fortunately, and maybe causing that to happen. But I think it's a little similar to what we talked about the two linemen, is that it can just be this lingering thing that he always gets tweaked. You know, he gets twisted up or hit the wrong spot and he gets tweaked, and now he's coming out of the game or he's not as mobile. So it just never fully gets back to, you know, being a fully recovered ankle. So that's kind of the danger with that.
Dr. Kumar, if you don't mind, we didn't get this one on the list, but we're finding out again that after he said that it wasn't bothering him, Joe Burrow once again dealing with that wrist injury, that torn ligament from last season that cost him his year. There's a lot of talk about why this is a difficult injury to recover from, especially for a quarterback, and how this potentially could impact him not just obviously last season and now this season, but maybe for the rest of his career. How much concern should there be for that?
I mean, if you're Cincinnati, it's everything, right? I mean, as we know, the NFL is a quarterback league, and Joe Burrow at his healthiest, you know, runs an offense that's one of the best in the NFL. And, you know, a young guy with a large contract, you really put the weight of your franchise in your quarterback. And so, yeah, I mean, that's a tough situation, throwing hand. And, you know, the thing about the NFL is sometimes small injuries can just continue to bother players because it's just a violent sport, right, guys? And you cannot predict what type of body position, where you're going to get hit. Everything happens in a flash, especially as a quarterback when you're just kind of, you know, sitting back there as a pocket guy like he is. So, you know, all the concern for that franchise to make sure it's 100% and can give him a healthy career.
When we look at Joey Bosa of the Chargers, back to the Chargers, he walked off with trainers after one snap against the Steelers. He's dealing with a hip injury. How tricky can those hip injuries get? What are we typically looking at there?
Yeah, I mean, you know, core injuries, if anybody's hurt their low back or pulled a hip flexor, done too many sit-ups, they can tell you that, man, core injuries just are not happy injuries. And for a guy like that who's trying to explode around the edge, beat, you know, heavy offensive linemen and got his body kind of in awkward angles, you know, sometimes some of those things can slow him down. And nobody wants to be out there playing at 60%. Fortunately, a lot of those core injuries can be treated with rehab and conservative measures. So hopefully this is something that maybe he'll miss a little time, or that they can get him back up and running 100% because he's a great player.
I'm glad you brought up the bend and the angles that you see from defensive ends, because I think sometimes people overlook that, right? They're not utilizing their bodies the same way as a lot of NFL players are. The way they get around the edge, there's so much bend, there's so much torque on their bodies while they do that. I'm kind of curious, if you're working with a pass rusher and somebody that's going to be in those positions as opposed to a guy that plays a different position, are there any different things you're doing as far as the rehab? And are you waiting longer to let them come back because of the way they use their bodies on the field?
Man, that's a great question. I mean, sometimes you might have to. I think sometimes, kind of we talked about Vita with his MCL, you'll see a lot of times when you watch college football, a lot of the offensive linemen and a lot of programs are wearing these heavy-duty braces because these linemen get rolled up on, and sometimes those braces can help with preventing MCL injuries or minimizing them. But if you got a guy running off the edge, look up highlights of Shaq Barrett. I mean, his body is almost horizontal to the ground. Every time you add some tape, you add some braces, you add some extra padding, he's just not going to be able to get his body in those types of crazy angles, which make them great players. So then he becomes less effective, So there's always that give and take there to keep him on the field. But at the same time, making sure that he is the player that he wants to be.
I gotta step up a little bit during these interviews, Doctor. Last week, Pat got 2 good questions said to him. This week, he got another one good question.
I think it was a great question. Actually,
it was great. It was. I think it was great.
Question.
It was a really great question. I'm gonna be better, Doctor. I'm gonna get better. All right. I'm gonna get better. I'm gonna get a great question out of you and all the remaining doctors. You do a great job. We love you coming on the show, and we can't wait to talk to you again. The Pat and Aaron Show Injury Report was presented by Tampa General Hospital in partnership with our great friends over at Florida Orthopaedic Institute, providing you access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com. And when you go see Dr. Kumar, have a really good question ready, because I can imagine how great it felt for Pat when he said, "Great question, Pat." Thank you, Dr. Kumar. Appreciate you, man.
Hey, have a good morning, guys.
Thanks,
Bye.
Doc.
That's 2 in a row, bud.
Hey, what can I say? I'm on a heater.
You're on a heater right now.
It's the, you know what it is? That's what happens. The older you get, the more in tune you are with physical medical questions.
No,
the more you have.
No, it was a really good one with the torque and the using the body as a pass rusher. Don't sell yourself short.